And we are back. The Nurse Practitioner Fellowship at Montefiore Medical Group is unique in its approach, its comprehensive approach rather, to prepare healthcare professionals, focusing not only on their clinical skills, but also on the broader impact they'll have in medically underserved communities. Joining me now is the director of the Nurse Practitioner Fellowship in Primary Care at Montefiore Medical Group, Kathryn Tanner. Kathryn, good to have you.
Nice to be here as well.
Thank you. So this fellowship program actually really deals with helping for much need in our community. Talk to us a little bit about the fellowship program and how it's really benefiting underserved communities.
Yeah. So this fellowship program is to provide new nurse practitioners, new providers with a comprehensive training program so that they have mentorship and supervision for their first year of practice. The overarching goal of the fellowship is to increase access to Bronx patients. And we're doing this by preparing nurse practitioners to be the ones providing this care.
Yeah. So how does it work?
So our nurse practitioner fellows spend 1 year working with experienced clinicians, physicians, and nurse practitioners in the clinics where these clinicians already are working. They'll be seeing patients 3 days a week, discussing the care of the patient with a seasoned provider. They're also going to be spending 1 day a week in various specialty rotations, working with experts at the Montefiore Medical Center in nephrology, endocrinology, mental health, getting more experience treating diabetes, hypertension, various disease processes that our communities are disproportionately affected.
Yeah. Talk to me about the hands-on training, because as they get this hands-on training, obviously an asset to, you know, the work that they'll be doing in the future. But when you receive that hands-on training, there is something that comes along that really makes the difference. So how does that hands-on training really lay out?
Yeah. So these are all, you know, all of the nurse practitioners who are in this program are licensed, credentialed, they've gone through their training programs, and this year is meant to increase their confidence by providing them with more clinical skills. So they are seeing patients in the clinic and they're getting expert advice on how to manage these patients, their care. And so we hope that by the end of this training year, our nurse practitioners will have an increased level of confidence. Will continue to be committed to serve in these communities, and they'll just be better prepared providers.
Yeah, and at the core of this too, you know, we're talking about healthcare equity, and that's huge.
Yeah.
Because in a lot of communities, the resources aren't there, the personnel isn't there, but here through this program, things are a little different.
Yeah. We're really training these providers to stay in the Bronx and serve the communities in the Bronx.
Yeah. So we got some social determinants too, right?
Yes.
When it comes to health.
Yeah.
And I wanted to unpack that for a few moments, right?
Yeah.
Talk a little bit about those social determinants, and you know, you incorporate that as part of the curriculum.
Yes. So much of their orientation has been you know, emphasizing the social determinants of health, thinking about health equity, housing, nutrition. You know, healthcare doesn't stop when our patients leave the clinic. And so how are our primary care providers sort of thinking about the ways that they're educating patients, you know, incorporating social determinants of health into these plans of care. One of their specialty rotations is going to be working with community healthcare workers. So going out into the field and seeing what patients are dealing with outside of the clinic, what sort of barriers are patients experiencing when they leave the clinic. And this is a really important component to Montefiore's Nurse Practitioner Fellowship, and we hope it'll continue to inform the care that they provide for their entire career.
Give us an inside look as to a new clinician who walks through the door. What's it like for them, and what's the mindset like? Because obviously, you know, there's still some work that needs to be done. You've made a lot of advancement, but I know there's got to be some butterflies and jitters even as a new clinician.
Oh, definitely. And that's really another, you know, large component of this program is to help reduce some of those fears and anxieties. The jump from nurse to nurse practitioner is a big jump. And we hope that this training year will provide these new clinicians with the increase in confidence that they need to stay in this profession.
Yeah. So actually, what was the motivating factor for Montefiore to really decide to do this here?
It's really about expanding access to primary care in the Bronx. We, you know, in the Bronx, along with the rest of the United States, have a shortage of healthcare providers in every field, and specifically in primary care. And primary care, you know, it's preventative medicine. It's the most important part of healthcare, in my opinion.
Right.
And so we need to expand access to primary care, and that is what Montefiore is doing with this fellowship. Really, it's about providing more care to the patients in the Bronx.
Kathryn, as a person with boots on the ground, give us what it's like on the front lines when you don't have those kind of resources, when you don't have the kind of things. How does that affect?
Yeah. I think that if, when patients don't have access to primary care, then they don't have access to preventative health interventions. And so you see more emergency room visits, more urgent care visits, less ability to, learn about different disease processes early on before they become something that critically affects your life.
Yeah. And so after a student graduates out of this program, where do they go from here?
They stay at Monty.
All right.
Yep.
And so for the students that are actually, I should say the doctors that are actually staying at Monty, it's got to be a good feeling having that opportunity to, do this here and then really carry on and be right in the same place. A win-win of sorts?
100%. I'm very proud of this program. I think that we're really training our peers. The clinicians who are working with our nurse practitioners are going to be their peers as soon as they graduate, and we have a hand in really training them to provide the care that we think is important. Patient-centered care, evidence-based care. This is a huge emphasis of the program.
All right. Before we go, talk about the uniqueness of the program.
Yeah.
And what makes you guys so special, because it is a special program.
Yeah. Our program is unique in that it allows our nurse practitioners to sort of integrate into primary care in a very safe and measured way so that they are able to really focus on becoming experts in this field, and that they'll be able to provide the best care possible to the patients who really deserve the best care possible.
Kathryn, it's been great having you.
Thank you so much.
Come on back and visit.
Thank you.
Congratulations.
Thanks.
All right, listen, if you want more information, please go ahead, visit the website, MontefioreEinstein.org. There you can find out all that you need to know. Listen, don't go anywhere. We got more open coming up right after this, and you don't want to miss. We got a full show.